Hello, and welcome to the Hawaii Health Data Warehouse's Coffee Break Monthly Webinar Series. I'm Julia Chosey, a public health epidemiologist with the Hawaii Health Data Warehouse, or HHDW, and we're going to use the next 30 minutes to explore sexual orientation and gender identity data in hhdw.org and hawaiihealthmatters.org. Today, we're going to be exploring sexual orientation and gender identity data in hhdw.org and hawaiihealthmatters.org. First, let's review some definitions. So, sexual orientation is about who you're attracted to and who you feel drawn to romantically, emotionally, and sexually. Some examples include heterosexual, homosexual, and bisexual. It's different from gender identity. Gender identity isn't about who you're attracted to, but about who you are. So it includes categories like male, female, non-binary, and transgender. When we talk about sexual or gender minorities, we often refer to LGBTQIA+, or some variation of that. Sexual or gender minorities include those individuals whose sexual orientation is different from heterosexual and those who identify as a gender other than male or female. This could include people who are lesbian, gay, bisexual, transgender, queer or questioning, intersex, asexual, and more. There are many reasons why it's important to collect data on sexual orientation and gender identity. But first of all, there's patient care. So SOGI data helps providers understand a patient's needs and ensure that they receive the right care. For example, a transgender man assigned female at birth may still need to be screened for cervical cancer. SOGI data also helps identify and address health disparities that affect the LGBTQIA+ population. This is a population that suffers many disparities in health outcomes and access to care. SOGI data can also help build trust and rapport between patients and providers. When providers know a patient's SOGI, they can avoid making assumptions or using the wrong pronouns. SOGI data can be used in clinical decision-making, and it can also help healthcare organizations evaluate the effectiveness of their programs and improve them to meet the needs of the LGBTQIA community. The collection of SOGI data is vital for identifying the unique health needs of the LGBTQIA community, who often face significant health disparities and barriers to accessing healthcare services. Before we launch into the demo, I want to share with you the data sources we have in hhdw.org and how SOGI data is collected by them. So in HHDW, we house 4 population-based surveys listed here. And then we also have our vital statistics data for the state, our birth and death data. Let's take a look at how each of these sources collects SOGI data. The BRFIS is a major source for adult health data in the state. It covers a wide range of topics, including health status, health-related risk behaviors, chronic condition, and use of preventive services. In Hawaii, we started asking a question about sexual orientation in 2011, and we added a question about transgender status in 2014. We were a bit ahead of the curve as the National BRFIS didn't introduce a module for collecting SOGI data until 2014. Here's the current sexual orientation question used by BRFIS. Although there have been minor changes in the wording over the years, we're still able to trend the data from 2011 to 2022. The categories are straight, gay or lesbian, bisexual, and something else. Here's our most recent data. It shows that more than 6% of adults in Hawaii identify as something other than straight. This equates to over 66,000 adults in the state. To assess transgender status, the BRFIS asked the following question, and Hawaii has been collecting data on transgender status since 2014. Currently, less than 1% of the adult population in Hawaii identifies as transgender, and although this is a small percent, it still equates to over 5,000 adults in the state. So taken together with sexual orientation, we can see that 6.4% of the adult population in Hawaii identifies as sexual or gender minority, and this represents approximately 70,400 adults. Our pregnancy risk assessment monitoring system, which asks about experiences, attitudes, and behaviors before and during pregnancy and shortly after delivery, does not collect any sexual or gender minority data. The Youth Risk Behavior Survey, which covers the health risk behaviors that contribute to the leading causes of death and disability among youth and young adults, here we can see that the sexual orientation question started being asked of high schoolers in 2011 and middle schoolers in 2017. This is the first question that was used. Beginning in 2021, the question expanded to offer more response options. And because of this significant change in the question, HHDW is unable to trend sexual orientation data between 2019 and 2021 for the YRBS. Beginning with the 2023 data, which will be released soon, we can show the results for this question using the following response options: straight, gay or lesbian, bisexual, other, and questioning. Our most recent data shows that nearly a quarter of high school students identify as something other than straight. This equates to about 11,300 students in Hawaii. Here we see the data for our middle school population. And although the percent identifying as something other than straight is higher here than for high schoolers, we might take note of the nearly 10% who answered questioning. Many kids at this age are still trying to understand their sexuality. Hawaii introduced a question about transgender status in 2017 for high schoolers and 2019 for middle schoolers. Here's the question and its response options. Our most recent data shows that only 2.2% of high schoolers identify as transgender, but this still equals 1,000 high school students in the state. For our middle school students, the percentage is similar, with 2.7% of middle school students identifying as transgender, and this equates to about 800 students. So taken together, we see that 23.6% of high school students identified as a sexual or gender minority. 30.9% of our middle school students did. So this still represents a good portion of our community. In our youth tobacco survey, we asked about sexual orientation beginning in 2017, but unfortunately the survey was suspended after data collection in 2019, so more recent data is not available. However, you can look at the indicators by sexual orientation and transgender, which we started asking in 2017, for these indicators. And then last, in our vital statistics, no sexual or gender minority data is collected, and perhaps in the future this will change. All right, it's time to transition to our demonstration, but before we do, I just want to remind participants that HHDW manages two great data websites, Hawaii Health Matters and HHDW. Hawaii Health Matters offers more context with the data, with resources like reports, plans, fact sheets, and infographics. HHDW gives you the power to create your own reports and customize the data to your needs. Both sites offer SOGI data, as I will show. We're going to start with Hawaii Health Matters. For those of you that are unfamiliar with this site, this is the homepage. You can check out our monthly featured content. You can see about recent data releases and sign up for our coffee break. So check back later for our December coffee break. What I want to do is just jump right into the search. And I'm going to search for sexual orientation. The nice thing about using this search option up here is that not only does it search the indicators, it also looks through the resource library to pull up things like promising practices and reports, and in this case, a presentation that are relevant to your search topic. So this is a great way to see what kind of additional information is available on the website. Let's take a look at sexual or gender minority adults. So the first thing you're going to see is the geographies that this indicator is available for. We're just going to look at the state, but it is good to know that you can find this data for smaller geographies if you're working with smaller communities and you would like to know how they measure up related to the state. So here we go. This is our indicator, sexual or gender minority adults. This gives the definition. So this indicator shows the percentage of adults who identify as gay, lesbian, bisexual, something else, or transgender. And then we have a little information about why it's important, the public health importance of this measure. After that, we get into the data. So we can see the source here is the Behavioral Risk Factor Surveillance System. The most recent year of data is 2022, and we can see that 6.4% of adults identified as a sexual or gender minority. So this is great, but to give the data a little bit more context, Hawaii Health Matters offers some comparison values. In this case, it's just showing the comparison to the prior value, which has not changed statistically, and the trend, which it is trending up in a significant fashion. And you can hover over these icons to get more information about each one that help you interpret the data. Below this, we get our trend data, so we can see the measurement over time. You can hover over the chart to see the actual data values. You can also download this as a JPEG or a PDF, and you can download the underlying CSV data if you wanted to do your own visualizations. So below the trend data is where we start to see our subgroup data. So this is where we take this measure and break it out by all of these different subgroups. So we can see right away here that by age group, there's definitely a higher prevalence of sexual or gender minority adults in the younger age groups. And that confirms what we saw with the Youth Risk Behavior Survey. But we can also look at sexual or gender minority status by education level, by employment status, by percent of federal poverty level, by race, ethnicity, and by sex. So this gives you a great overview of this indicator and shows you exactly how it's being distributed across our community. Below the breakout data is where we have our geography data. So I mentioned these 3 geographies are available for this indicator, and we'll just take a quick look at the primary care service area so you can see what this looks like. When you look at the data by geography, you get a nice map, you get a chart, and a data table. And what it does is it ranks each of the primary care service areas from low to high for prevalence of sexual or gender minority adults. So this is a great way to look at more community level data. And here's the table. You can do some modifying of the table. You can also download the CSV data. And then below that, it gives you a little bit of information, some descriptive statistics, talks about the data source. And then here again, it gives you this related content. So here we can see some other indicators that are related to sexual or gender minority adults. Again, these reports and this presentation. Let's quickly take a look at one of the teen indicators. So this is LGBT teens with suicidal thoughts. And again, it gives you some of the information about why this is important and gets into the data. Here, it provides a few more comparison values. We can see that we're actually doing better than the US value overall. The prior value hasn't changed significantly. It is trending up, although not significantly. And we have met the Healthy People 2030 target of 52.1%. So here we can see the trend over time. And then we also have a few subgroups. So we can look at the data and see the differences over grade level and by sex. So these are the indicators that actually involve sexual orientation and gender identity. However, I've told you that most of the data that we get from the Behavioral Risk Factor Surveillance System and the Youth Risk Behavior Survey are available by sexual orientation and gender identity. So let's take a look. I'm going to build a custom dashboard real quick. And if you're interested in learning more about that, there's a video right here that can teach you. But I just want to show you some of the, or all of the indicators that are available by sexual orientation and gender identity. So we've got the Youth Risk Behavior Surveillance System and the Behavioral Risk Factor Surveillance System. Okay, there we go. So now we can see the selection of indicators that are available. And for the majority of these indicators, if you go into and look at them, one of the subgroups will be sexual orientation. So you can see we have a lot of information that you can get by sexual orientation and gender identity. So this is, I won't scroll through all of them, but this is just an idea of some of the indicators that we have available. I did want to show you how you find those sexual orientation and gender identity data. So let's look at healthcare access and quality. So we'll look at adults with a usual source of healthcare. So here we can see the data for the state, 88.4%. We get our comparison values that put it into context. We have our trend data. But if we're interested in looking at it by sexual orientation, we can just click this box here. And now it will show us, okay, LGBTQ adults are less likely to have a usual source of healthcare than the state overall. the system does some statistics for you. So when you see red, it means it's significantly worse than the state overall. And when it's green, it means it's significantly better. So this is an example of some of the data that's available by sexual orientation and gender identity. We have quite a bit here in Hawaii Health Matters. Let's switch over to HHDW. So this is our homepage here. There is a website overview video here for those of you who are not familiar with the site. And a lot of the pages have links in them to video tutorials. I want to show you two things. Our community reports, which by default goes to race ethnicity. However, we do also have sexual or gender minority. And again, by default, it goes to no, but we might be interested in looking at yes. So what this is going to show us is a collection of important chronic disease indicators and health risk indicators. There's two sets. And what it shows you is the estimate for sexual or gender minority population. It gives you the confidence interval, and then it compares it to the state value and gives you a little icon here to show you which ones are worse and which ones are similar, and also which ones are better. So you can see here for our chronic disease indicators, we have things like asthma and cancer, high blood pressure, diabetes, physical activity. And if you wanted to see more detail, all you have to do is click on a particular indicator. This one here, it's going to show you the summary report. So this will show you by race, ethnicity, county, and sexual or gender minority. But if you were only interested in the sexual or gender minority, you could go up here to the data view and select by sexual or gender minority. So now you're seeing the data in chart and table form. And then there's also some additional information, again, why it's important, definitions. There's a suggested citation in case you want to use any of this data. And you can print the page, you can email it, all of those things if you're wanting to share. So quickly, let's just look at the health risk behaviors. So this is another set of indicators that are displayed the same way. So we have alcohol, drug use, obesity, healthcare access, mental health. This is just a great way, like I said, to see an overview of some of the important indicators and how this particular community is measuring up to the rest of the state. All right, I mentioned that BRFIS, the Behavioral Risk Factor Surveillance System, and the Youth Risk Behavior Survey are our two data sources that have sexual orientation and gender identity data. So let's take a look quickly at BRFIS, and we're going to build a custom BRFIS report. And then here is our indicator selection page. So we have some resources here to help you explore the data. And then we have categories and subcategories that represent all of the data that's available from this data source. So you can look at sexual orientation and gender identity by itself. So in this case, maybe we'll look at sexual or gender minority. And what it's going to show you is the 3 most recent years of data in a chart and a table form. And again, there's some notes below about details for the indicator and suggested citation. But for those of you who are familiar with this site, you know that the power of this actually comes in being able to modify your query. So if we click here, now it takes us to this query builder page. And it looks like a lot. There's a lot of steps. But those first 7 steps are actually all just filters. So if you were interested in just females, for example, you could limit the data to females. Or if you were only interested in a particular race ethnicity, you could limit the data to that. If you want to see the whole population, but you want to see it broken out by different sociodemographic characteristics, then all you need to do is tell the system what you want to see in step 8. So for example, here, let's look at sexual and gender minority by age group. We've seen a little bit of this on Hawaii Health Matters, and we're seeing the same relationship here, that a higher prevalence among our younger adults. But you can also look at the data by any of these demographic characteristics. So if you were interested in race, ethnicity, education, poverty, and even some health outcomes like healthcare coverage, diabetes, current cigarette smoker. So this is a really powerful system. And just to show you one more thing it can do, it can actually look at two dimensions at the same time. So now we are looking at orientation by age group and sex. So this is great. It's a very powerful system. You can learn a lot. But in addition to the actual demographics, being able to look at sexual identity and orientation by itself, most of these indicators here are available also by sexual orientation and gender identity. So you can see, for example, we could look at depressive disorder. We're going to just use the crude rate for now. And what we see here are the 3 most recent years of data for the state. But what we can do is modify that query again, skip all the filters because we want to see the whole population, and look at it by one of several options of sexual orientation or gender identity. We'll look at sexual or gender minority. And now we can see, oh, there's quite a difference. So this is a great way to identify health indicators that are disparate among the sexual or gender minority population. The data for the Youth Risk Behavior Survey works the same way. So you can either look at the demographics and look at sexual orientation itself, or you can choose any of these indicators and look at the data by sexual orientation. Now let's give you time for some hands-on work. All right, let me go ahead and go through the questions. So starting with Hawaii Health Matters, the first question, it says, what percentage of LGBTQ teens use e-cigarettes? So we're going to go to Hawaii Health Matters. We're going to search for e-cigarettes. And we'll see teens who use e-cigarettes. We're going to look at the state value. And we're interested in looking at it by sexual orientation. So we click this button here, and now we can see the data by sexual orientation. So the percentage of gay, lesbian, bisexual, and other teens who use e-cigarettes is 19.4%. Our next question asks about disability among LGBTQ adults. So this is also for Hawaii Health Matters, and I'm gonna search disability. We're interested in adults with a disability. And we're interested in looking at the data by sexual orientation. So here we can see the question was a true or false question that LGBTQ adults are more likely to have a disability than adults overall. And that is true. Our third question uses Hawaii Health Data Warehouse, and it's asking what percentage of Native Hawaiian adults identified as transgender from 2020 to 2022. So we know we're going to want our adult data, our behavioral risk factor surveillance system data. We're going to build a custom report. And we are interested in transgender status. So here we're going to get the prevalence of transgender status for the 3 most recent years of data for the state. But the question is asking about Native Hawaiian specifically. So again, we just go to the modify query. We're going to keep the whole population in there, but we want to see it by race ethnicity. So we tell the system that that's how we want to see it. And now we can see there's a lot of data missing because these sample sizes get small, but there is an answer for Native Hawaiian, and it's 0.7%. All right, the last question asks about physical activity among high schoolers. So I'm going to go ahead and switch to our Youth Risk Behavior Survey data. We're going to build a custom YRBS report. And this asks which sexual orientation had the lowest rate of meeting federal physical activity guidelines among high schoolers in 2019. So we're interested in high schoolers, we're interested in physical activity, and we're interested in meeting the federal guidelines. Now, this is going to show us data for 2017, 19, and 21. And we are interested in data for 2019. So one thing we can do is filter this query to 2019. You can also look at the data by year and by sexual orientation, but it's a simpler output to go ahead and filter to the year of data that you're interested in. And here we can see that it looks like gay or lesbian students have the lowest rate of meeting the federal physical activity guidelines among high schoolers in 2019. So I hope that was helpful. If you have any questions, please feel free to email us at profiles@hhdw.org. I wanted to invite you to join us in December for our next coffee break webinar. On December 3rd at 11 a.m., we'll be discussing the 2023 Youth Risk Behavior Survey data release on HHDW and Hawaii Health Matters. So please join us then.